looking.
Excellent. Then in vital parameters? Steady look. Okay.
Vital parameters is a pulse rate.
Pulse rate is important. Tachycardia, bradycardia. Tachypnea or not. Okay. Then comes the signs starting from the pallor. You would check for pallor. Clubbing you would check.
Thyroid
Acropathy.
So check for clubbing, thyroid acropathy, sweaty hands,
palmar erythema,
palmar erythema, warm moist hands, and then you would go to
lowering
for pretibial mixing. Very important all this. And then you would also check for
fine tremors.
fine tremors. And then lastly you would check for eye signs. What are the eye signs? She will demonstrate one by one. 4 or 5, you remember? Very good, good.
So on inspection of the eye, there is no nystagmus and there is no lid retraction. The superior sclera is not visible.
Very good.
And now I'd like to assess for any lid
Lid
lag.
lag.
Please look at my eye. Follow my hands without moving your head. Okay, the superior palpable is following the eye.
So no lid lag. Next is?
Next is any conversions of the.
So you ask the patient to look at a distance and bring the
Can
finger
you
in.
please look far and then look at my finger?
So failure of
Convergence.
Failure of accommodation.
Next, I'd like to assess on this nystagmus. Please follow my finger.
Slowly, slowly. Nobody can move like this, dolls and movement. Slow, very slow.
There's no nystagmus. Next is
Wrinkles of
wrinkles on the forehead. Okay, can you please look up without moving your forehead? Look up without moving. No wrinkles.
Okay, then you would also check for any conjunctival and corneal edema, chemosis. Chemosis, okay? Check for any corneal or conjunctival edema. That is also inspection.
Do I use pen touching that?
No, it's okay. Just an inspection of the cornea, whether it appears congested and edematous. That is chemosis. Okay, and lastly, you would check for exophthalmos.
Exophthalmos. I'll stand on patient's side.
So this
to
is
see
one way.
if the-
Go down and check whether you can see the eyeball beyond the lateral margin.
And then this is superior margin of all the patients that like this.
Tilt the head and look from vertical. If you can see the eye beyond the superior orbital margin. So those are the two ways of checking exophthalmos.
Doctor, we would move forward, right? We won't ask the patient.
You tilt the patient head.
You stand, you don't have to do like that.
Okay.
Tilt the head like this and see from top. Okay? Unless you are very short, then you may have to.
Jump scare.
Okay, so this is a general examination which you have done. Have you understood?
Yes.
Neck lump. Now comes the local examination of the neck. The position is patient should be sitting comfortably on a chair. The neck should be in a neutral position. It should not be extended or flexed. The clavicle, the neck should be exposed from mandible to clavicle. Clear? And then you would, as an examiner, take a chair and sit in front of the patient and start your inspection. Now she will tell one by one what are the points to be checked on inspection of the neck. Number one.
Is there any visible lump on the
Very
neck?
good. So first thing you are looking for is a lump. If there is a lump, then you would describe the lump that on inspection of the neck, I can see a lump on the right side or left side or midline, whatever. Okay? So that is a site. Number two,
Approximate the size.
approximate size. Say there is a 3 to 3 centimeter lump, approximate size, situated on the right side of the neck. Number three, okay, shape, whether globular or whatever. Number four, number of lumps, solitary or multiple. That is important. In lymph nodes, you may have multiple lumps. Okay, number five, very important.
Drink water. Ask to drink water.
Water. Drink water.
Deglutition.
Transmission to swallow.
Yes. And see whether the lump moves on deglutition. That is very important. Okay. So then say on swallowing, the lump moves on deglutition. The rest of the things you can tell.
Any overlying skin changes.
Any skin changes in the form of edema, inflammation, erythema, ulceration. Number 6.
Dilated veins.
Any dilated veins in the neck. Number 7.
Surgical scars.
Any surgical scars in the neck. Number 8.
Pulsatility.
Pulsatile, whether the lump appears to be pulsatile or not. Very good. Anything else? If the lump is situated near the midline
Tongue protrusion.
or in the midline, you would ask the patient to stick out. Protrude the tongue and see whether it moves up on protrusion of tongue. If it moves on protrusion of tongue, that means it is a thyroglossus. Is it clear?
Yes.
Don't do for a lateral lump if it is near the midline or in the midline. Because thyroglossus cyst is always in the midline. Okay? So this is about inspection. Anything else we have missed? Kamal? Inspection, you are satisfied? Any other points we have missed?
Scars dah cakap.
Done? Or you think that there is something else to be done on inspection?
No.
No? Okay. They are satisfied.
Okay.
Now comes the
Palpation.
palpation. So for palpation, the position remains the same, except that most of the palpation you would be doing from behind. But there are few things you would also like to do from front. The technique remains the same. You always palpate with the
Flat of the
back of your fingers, following the contour of the neck with the gentle rolling movements, and try to extract whatever information about the lump. Okay, so what are the things you would do from front?
tenderness and inflammation.
Okay, so can you demonstrate? How would you check for?
Actually, I'm not sure whether I should be standing or I should be squatting or.
You can stand there. There is no-
I can
You
stand.
can measure. So first is size. You would measure the
Size.
in both axes. Okay. Next is how would you palpate for tenderness? Gently palpate and look at the patient's face because you have to check the tenderness from patient's reaction, which you cannot do from behind. Okay. So tenderness, size, and number 3 you would check for trachea,
Tracheal deviation.
whether the trachea is central or not. Already deviated, no wrinkling. Don't scare him before the exam. Huh? Okay, so these are the 3 things you would do from front. Once you have done, then you would go and then start your palpation.
If let's say the lump is on the right side, then I'll palpate to feel.
Okay, then you have to slightly flex the neck. You always start from the anterior
Anterior
border of
sternum
sternum as
side.
well, laterally, superior, and then go inferior, same level, same level. Once you finish, go medial now. Go again, superior to inferior. Yes. Correct. So it is in strips. Okay? Keep on doing till you reach the midline. Yes. Once you encounter a lump, I think the things are the same which you would describe. Number 1 is sight. Number 2 is shape. Number 3 is size. You would measure it. You have already measured it. Number 4 is number of lumps. Single or multiple. Number 5, consistency. Number 7, surface. Number 8, margin. Margins are well defined or not. Number 9, mobility. You know how to check for. Here you don't have to hold the neck. Okay? Otherwise, you would, one hand you would throttle the patient. Okay? So don't hold with your left hand. Here you just check the mobility. Number 9. Yes, very good. When you're asking the patient, oh, I forgot, you must check the swallowing. That should be right at the beginning, in fact. So what you do is you keep your hand on the lump and ask the patient to swallow and confirm that it is moving with deviation. That is one thing. And the second thing is you take your 2 fingers and put the fingers at the inferior part of the lump, like this. and ask the patient to swallow again and try to feel the
Inferior border.
If you feel the inferior border, then say that inferior border is felt clearly or palpable clearly. Okay? If you cannot, then possibly there is a
Retrosternal extension.
Is it clear?
Yes.
Okay, what else? Fixity to skin. Pulsation. How would you check for pulsatility? No. Take your 2 fingers and keep it at the lung. Okay? At the two opposite ends. So suppose if this is the lung, keep it like this.
Oh, okay.
And check whether
This
fingers are moving apart. That is an expansive impulse. Expansive. Like this. Move like this. That is a truly vascular swelling, like an aneurysm. If it moves like this, that is not expansive, that is transmitted. That means the swelling is not vascular, but it is overlying a vessel. And it is transmitting the pulsation of that vessel. Is it clear?
Yes.
So for vascular swelling, the impulse would be expansive. So you would check the pulsatility and again the fixity to skin. So try to pinch the skin over the mouth. Okay? And fluctuations. You know how to do fluctuation.
Yes.
So these are the things you would check on the lung examination. I hope it is clear. No, you check, when you mentioned that there are multiple nodules felt on both sides or one side, and the largest you measure. The largest of them measures the center. Okay? You can also check the local temperature by palpating the feeling for the back of the skin. Any inflammatory lung would have a local level. So compare it with the surrounding skin.
for the lung.
Local rise of temperature. I think these are the few points which you check on lung examination. The most important is movement of deglutition and feeling for the inferior. Rest are similar to other lungs. Okay? And then your lump examination, neck examination would be incomplete till you do a cervical lymph node examination. All of you know the 6 important levels of
Yes.
so I think so one by one she will demonstrate. Just pay attention. Level 1,
Submental.
1A
Submental.
with your 2 fingers.
Okay. And then after that, submandibular.
Submandibular 1B,
And then after that, anterior of the sternocleidomastoid.
upper 1/3 is level 2.
2. Middle is
Level 3.
3. And then bottom is
Not bottom, lower 1/3.
is level 4.
Level 4.
Then after that, 5. Level 5
Five
start
is-
from the
So
mastoid.
mastoid posterior to the sternomastoid. Go right till the, follow the posterior till the clavicle. This is level 5.
And then
And level 6 is,
from the thyroid.
so from the, go below the thyroid until the suprasternal space in the middle. This is level 6. Okay? I think all of you know. This
Yes.
would finish your at least palpation of lymph node. For auscultation, you auscultate with the stethoscope at the superior pole of thyroid. So take your stethoscope and keep it at the superior pole of
Upper
thyroid
lobe.
and try to auscultate druid. Okay. Percussion is normally not required unless you feel that there is a retrosternal extension where you cannot feel the inferior border. In that case, you would also do percussion. How would you percuss on a chest wall? Can you demonstrate here? You can do both. This also, you can do this also. Yes. Okay. Both sides. Both middle, this.
Middle.
Okay.
Okay, so initially over inspection, if there's any visible lump, we comment. If there's no visible lump, and
On palpation, if you feel, then you see.
do it again. If it
So sometimes on inspection, the neck lump may not be visible. But maybe you see palpable. In that case, tell them something on palpation. Okay? Anything else? So we have done auscultation, we have done palpation of the lump and lymph nodes, and we have also done percussion. Now, last thing which is left is some special test, which you remember, which is one special test, which is known as Pemberton sign. What is Pemberton sign?
And then there will be
Condition of face. But for raising the hand, it should be like this, touching the ears. And wait for at least 30 seconds. Okay? See the dilated veins and condition of face. That would suggest that there is a possibility of external. And second sign is,
Paris
what's happening here? It's
hyperthyroidism.
hyperthyroidism. Restless.
Paris.
What is Berry's sign? Do you remember? Over? Berry, strawberry, strawberry. Absence of carotid pulsation. Where would you feel for carotids? Exact position.
Anterior sternocleidomastoid.
So at the anterior sternocleidomastoid at the level of thyroid cartilage. So first feel the thyroid cartilage. Go at same level. Anterior border of sternomastoid. Yes.
Yes, I can.
You can feel. So if there is any absence of carotid pulsation, that is a positive Berry sign, which is suggestive of malignancy. That is that malignancy has infiltrated the carotid sheath, and you cannot palpate the carotid pulse. So you should know where exactly you are palpating carotid. The surface landmarks. Okay. That is a part of and that is only done when you are suspecting. If you can clearly feel the inferior border, logically you don't have to do a conversion. But in exact don't take chance. Just do it. Okay, I think this is about neck exam. You can mention. I would like to finish my examination by doing a systemic exam like auscultation of chest, neurological examination, especially checking the reflexes and proximal myopathy, and also abdominal examination. Yeah? And cardiovascular, very important in thyroid. You can have so many arrhythmias and tachycardias. So a complete cardiovascular, neurological examination is essential in thyroid disorder. Is it clear? I think this is about neck exam. I hope you have, you know the investigation which is to be done. I think we have already discussed that. Any questions on this? Try to practice yourself for this. I think this is, if you know this much, I think it should be for your Osce. For your unmanned Osce, please go through X-rays. I have already given you the list of some X-rays you should know, common X-rays. Try to go through it. Similarly, try to go through some data and try to interpret it. Say a liver function test in obstructive jaundice or whatever, thyroid examination, thyroid function test. Try to interpret. Okay. So go through data.